Bismillahirrahmanirrahim. Assalamu alaikum. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli rabbi zidni ilma. The topic which we are going to discuss today is gingivitis. A very important topic, inflammation of gums. Uh, Most of the population is affected by one or two form of gingivitis. Gingivitis is the inflammation of the gums without loss of the underlying bone. The bone is not affected at all. Just the inflammation of gums is called gingivitis. It is a reversible form of periodontal disease if detected and treated early. If it is detected early, if your then your gums can be treated. It will not progress to the periodontal ligaments and bone, etc., or other periodontal tissues. But if it's not detected early, it will lead to gingivitis. Will lead to periodontitis. What are the causes of gingivitis? These are the main causes of gingivitis: dental plaque, poor oral hygiene. The most common cause is accumulation of bacteria at the gum line. That's why rinsing your mouth is very important. That is why saline goggles are very important. That is why good oral hygiene is very important. Brushing your teeth is very important. Poor oral hygiene, infrequent brushing and flossing. Tobacco use, smoking, chewing tobacco increases the risk of gingivitis. These things are not healthy for your gums, for your teeth, for your oral health, for your medical health, for your lung health, for your organs health. Hormonal changes. Gingivitis can also occur in pregnancy, puberty, menopause, pregnancy, menstruation. The hormonal changes, you have to take extra care of your oral health because they are more sensitive to be attacked by bacteria and other diseases. Medical conditions such as diabetes, immune disorders, or infections can also lead to gingivitis. Some drugs they cause gingivitis, or they prolong gingivitis, and they such as anticonvulsants, calcium channel blockers. They cause gum overgrowth, and which leads to inflammation of gums if not treated or detected early. Then nutritional deficiencies, lack of vitamin C or other nutrients, can also cause gingivitis. What are the signs and symptoms of gingivitis? Red swollen gums, gums bleeding gums especially during brushing and flossing, bad breath, halitosis, tenderness or discomfort in the gum may appear shiny or puffy. But in gingivitis, there's no attachment loss or bone destruction. If there's attachment loss or bone destruction, it's not gingivitis, it has progressed to periodontitis, which is more severe. Then there are the types of gingivitis on the basis of plaque are plaque induced gingivitis and non plaque induced gingivitis. Plaque induced gingivitis is most common. It's caused by bacterial plaque, as the name indicates. And the other gingivitis, which is caused by infection or systemic conditions or drugs or trauma, are non plaque induced gingivitis. How to diagnose? First of all, clinical examination of the gums, the color of the gums, size of the gums, consistency, bleeding, do they bleed on probing or not? Then dental x-rays if necessary to rule out bone loss. Then the treatment basically is that you have to address the underlying cause. Okay? Professional cleaning, scaling and polishing removes plaque and tartar. Then oral hygiene should be improved, brushing twice daily, flossing, using antimicrobial mouthwashes is very important. Medication adjustment, if drugs are causing gum growth, consult a dentist or physicians. And if there is diabetes, smoking, or other nutritional disorder, then you must address the underlying causes and control them or stop them. Now, how can you prevent gingivitis that it should not happen in the first place? Brush teeth at least twice a day with fluoride toothpaste. Floss daily to remove plaque between the teeth, which is very important. Regular dental checkups and cleaning is very important after every 6 months. And then your diet should be balanced diet, no junk food, no extra fizzy drinks, cold drinks, vitamin rich diet, and avoid tobacco products overall. These are the healthy gums, and this is the diseased gum. You can see it's puffy and it's swollen, and it will bleed on brushing. Gingivitis. Now this is the picture of healthy gums. Oh, sorry. Pink, firm gums attached to the tooth. No bleeding, healthy. Bone is also healthy. Now here you can say that it has gingivitis. Okay, red swollen gums, plaque buildup. The gums are inflamed, but there's no bone loss. Okay. Now when it's periodontitis, when it progresses further, then it leads to periodontitis. The gums will bleed. There's plaque. Plaque has, there's not only plaque, it's also tartar, like calculus, which are the thick deposits, and the pockets are formed. The बोन लॉस होगा साथ, ठीक है, बोन लॉस हो रहा है, टूथ आपको उतना फर्मली अटैच्ड नहीं नज़र आएगा एज इट इज़ इन द हेल्दी गम्स. It's not firmly attached. There is a bone loss has started. The bone is not very healthy here. Okay, the teeth becomes loose. So this is all about gingivitis. A brief introduction of gingivitis. Gingivitis is a very vast topic. This was a brief introduction about gingivitis. Jazakallah khairan kasira. Assalamu alaikum wa rahmatullahi wa barakatuh.